Hello and welcome to my YouTube channel. Today I am going to teach you about classification of anemia. In anemia, there is decreased hemoglobin production and it is classified as blood loss, anemia due to blood loss, anemia uh, due to decreased production of RBC, anemia occurs due to increased destruction of RBC, anemia that occurs due to the increased blood loss. It could be due to any acute reason or chronic reason. Anemia of blood loss, anemia may occur due to blood loss uh, due to acute cause. Acute cause may be trauma or due to surgery. Trauma may be due to road traffic accident or any minor or major trauma, or blood loss could also occur while surgery, while operation. And anemia of blood loss due to chronic regions may occur due to some chronic diseases like hemorrhoids, epistaxis, and some urinary or some lungs infection. We all know that the production of RBC takes place in the bone marrow. This is the bone marrow of any long bone. So the production of RBC starts from here, that is inside the bone marrow. We all know that the shape of the RBC is biconcave in nature, and RBC is enucleated. It doesn't contain any nucleus. No nucleus. RBC only contains hemoglobin and enzyme inside it. So when there is defect in cytoplasm of the RBC, there occurs iron deficiency anemia, or when there is defect in globin chain of the hemoglobin of the RBC, there occurs sickle cell anemia and thalassemia. And when there is nuclear defect, we all know that the RBC, mature RBC, doesn't contain any nucleus. While during the production of RBC inside the bone marrow, RBC transforms from enucleated to nucleated stage. That is, the immature RBC contains nucleus. That is proerythroblast, or erythroblasts, etc. contains nucleus. While the reticulocyte and mature red blood cell doesn't contain any nucleus. So when there is defect while the formation of the mature RBC, it leads to megaloblastic anemia. So the vitamin B12 and folic acids are required for the maturation of the RBC. When the mature RBC is forming from the immature ones, we require vitamin B12 and folic acid. So when there is defect in maturation, there occurs megaloblastic anemia. That is, the size of the RBC is larger than the normal RBC. And when there is defect in stem cell production, there occurs aplastic anemia. When there is defect in bone marrow itself, it will lead to aplastic anemia. We all know that the hemoglobin contains heme plus globin chain. heme, that is iron. When there is defect in or deficiency of only heme or iron, it leads to iron deficiency anemia, sideroblastic anemia, and anemia of chronic disease. And when there is defect in globin chain, there could occurs globin defect could occurs due to the defect in quality and quantity of the globin chain of the hemoglobin. When there is defect in quality, that is the quality of the globin chain is defective, it will lead to sickle cell anemia. And when there is defect in the quantity, like the globin chain is produced in less amount, it will lead to thalassemia. And when we talk about the increased destruction of the RBC, it occurs due to any hereditary reason and any acquired reason. And when it occurs due to any hereditary reason, it will lead to hereditary spherocytosis, like the RBC will produced as a sphere. We all know that the mature RBC is biconcave in shape, and in hereditary spherocytosis, RBC will formed as spherical shaped. And we all know that the RBC contains enzymes inside it. So when there is defect in glucose 6 phosphate deficiency, it is also the hereditary cause of RBC defect. And acquired cause of RBC defect is paroxysmal nocturnal hemoglobinemia. And